Imagine looking at your partner, your child, or your best friend and feeling completely certain that they've been replaced by an identical imposter. Not metaphorically, not in a paranoid, I don't trust them way. I mean, truly believing that the person standing in front of you looks exactly like them, but isn't them. This is the unsettling reality of Capgras Syndrome, a rare psychiatric and neurological disorder that turns recognition itself into a hallucination. Capgras Syndrome is what we call a delusional misidentification syndrome. It's not about memory loss. The person usually knows who you're supposed to be. The delusion is that you've been replaced by a lookalike or an imposter. For example, someone might look at their spouse and insist, "That's not my husband. He looks exactly like him, but he's a fake." This belief can extend to pets, family members, or even objects. Like, "This isn't my car. Someone switched them." Misidentification syndromes are rare, but it's deeply distressing when they do occur, both for the person experiencing it and for their loved ones. The leading theory behind Capgras syndrome involves a disconnect between two parts of the brain. One is the temporal lobe, which is responsible for recognizing faces, and two, the limbic system, which connects recognition to emotion. That feeling of familiarity or warmth when you see someone you love. In Capgras syndrome, those systems don't communicate properly. The person sees the face, recognizes it visually, but doesn't feel the emotional signal that says, "This is my mom," or "This is my partner." And without that emotional confirmation, the brain scrambles to explain the mismatch and creates a delusional explanation, which is, "That must be an imposter." Capgras isn't a standalone illness. It's usually a symptom of something else affecting the brain already. It's been observed in conditions like schizophrenia, especially paranoid subtypes of schizophrenia, dementia, particularly Lewy body or Alzheimer's dementia, traumatic brain injury, stroke, and certain seizure disorders like epilepsy. Sometimes it appears temporarily after severe stress, infection, or medication effects, but most often it's tied to an underlying neurological or psychiatric condition that disrupts recognition pathways. Imagine how terrifying that must feel. To live in a world where familiar faces suddenly feel all wrong. People with Capgras syndrome often withdraw, become paranoid, or even fearful of their loved ones for this reason. In extreme cases, they may lash out or run away to escape the imposters. For families, it's heartbreaking. They can't reason the person out of it because to the person, it feels as real as gravity. Treatment for Capgras depends on the underlying cause. If it is part of schizophrenia, antipsychotic medications and therapy are first line. If it is due to dementia or brain injury, supportive care and environmental stability help reduce distress. In some cases, addressing sleep, infection, or medication side effects can reduce symptoms. Gentle reorientation, reassurance, and structured routines can make a huge difference in people's lives, but logic alone doesn't break the delusion. The goal is to reduce fear and restore safety. Capgras Syndrome challenges one of the most basic human experiences, which is the ability to trust what we see. It reminds us how much of our perception relies on emotional wiring, not just visual recognition. In psychiatry, it's a powerful example of how the brain can protect itself from confusion, even if it has to invent a story that isn't true in order to do so. When you understand Capgras syndrome, you realize how fragile yet miraculous the brain's connection between feeling and knowing really is. It's a disorder that breaks the bridge and teaches us how vital empathy and safety are when that bridge collapses. If you or someone you love ever experiences symptoms like this, it's important to seek medical help as soon as you can, immediately, because conditions that cause Capgras syndrome are often treatable when identified early. This is one of those moments in psychiatry that makes you stop and say, the human brain is powerful and terrifying all at once. That's it for this topic tonight. Thank you for being here. I'll see you next time.